Hi, welcome to Providence St. Joseph Hospital. My name is Caitlin, and I am a registered nurse here in the cardiovascular unit. We are so happy to have you here with us today, and I would like to take a few minutes to walk you through your procedure from the time you register until you go home. You will meet many of our excellent caregivers here in the cardiovascular unit, as well as in the cath lab, and get a tour of our facility and an idea of what to expect during your stay here with us. On the day of your procedure, you will start here and enter through our main lobby. Once inside, you'll find our temperature kiosk where we will check your temperature, complete a brief COVID-19 screen, and provide you with our hospital-issued masks. From here, you will be directed to our registration clerk who will check you in and send you up to the second floor to meet your nurses on the cardiovascular unit. Once you have come up the elevators, you will go to your right and continue down the hall to our nurses station. Here, you will be greeted by a couple of the nurses on your care team. The office may have sent you with a couple of forms to fill out and bring with you on the day of your procedure, or we will ask that you bring in a copy of your home medications, and we will ask for those at this time. We will then show you to your room where you will be prepped for your procedure and returned to for your recovery afterwards. Depending on your procedure, the nurse will let you know what clothing you will need to remove for your particular case and have you change into a gown. We will have a belongings bag for you to put your clothing in and provide anti-slip socks to prevent falls during your stay. After you've had the opportunity to change into your gown, we will ask you a series of questions while obtaining your vital signs, such as blood pressure and heart rate, as well as start an IV. Depending on your specific procedure, you may have additional steps taken to prep you for your procedure. We will make sure to take this time to explain in more detail what to expect, answer any questions you may have, and address your concerns. Now that you are ready for your procedure, you can lay back and relax, and don't hesitate to give us a call with your call light if you need anything at all. We have the time to make sure all your needs are met. You can expect to meet one of your cath lab nurses approximately 15 minutes prior to your procedure. If there are any delays, we will keep you up to date to the best of our abilities. Your procedure nurse will transport you back to the cath lab where you will meet the rest of your procedure team. In the cath lab, we will assist you in transferring to the procedure table and get you connected for continuous monitoring of your vital signs. Our rooms are kept cool for our equipment, but we will keep you warm with blankets from our warmer. Your nurse will have key information regarding allergies and lab results that will be communicated to the team before beginning because your safety is our #1 priority. You will then begin receiving IV sedation to keep you comfortable for the duration of your procedure. After your procedure is complete, the nurse will help to assist you in moving back onto your gurney and transport you back to your room. Once in your room, you will be connected to the monitor where we will closely monitor your vital signs while you wake up. Your procedure nurse will give your recovery nurse a handoff report, and your incision site will be visualized. For the first hour, you can expect to see your nurse every 15 minutes or more often if necessary to ensure that your recovery is smooth. Depending on your procedure, the doctor may order additional imaging or a bed rest time prior to going home. We will provide you with something to eat and drink during your recovery and do all we can to keep you comfortable. We will have an approximation of when you will be ready to go, and we'll contact your ride to help facilitate your transition back home. If the doctor has written any new prescriptions, we will make sure to call them in, as well as make sure you have a follow-up appointment scheduled as ordered by your doctor. You will receive a copy of your discharge instructions, as well as education specific to your procedure and the sedation you received. That should help to answer any questions you may have after you go home. All patients receiving sedation are required to have a wheelchair ride out of the hospital, and we are happy to bring you down to the pickup drop-off zone in front of the hospital to meet your ride.
Thank you so much. We look forward to seeing you soon.